Welcome back, Rohrich Knows Podcast. Salmon sperm injecting into the skin, polynucleotides. David Weir, world-renowned educator, nurse practitioner. What, is this for real? Does it work? I mean, I know Kim Kardashian. I know she's only had Botox, and now she's doing this.
Yeah.
So, first of all, does it work? How does it work? And can you really do this in the United States?
Oh, those are great questions, Dr. Rohrich. So I never thought in my entire 23 years of aesthetics practice that I would be talking about a salmon sperm facial. But here we are today. That's what we're talking about. So
polynucleotides.
Polynucleotides is what we're going to be talking about. And polynucleotides are fragmented DNA particles that are actually found in a very high quantity in salmon sperm. So are we putting salmon sperm on people's faces? No, but we are taking an extracted portion of salmon sperm, this polynucleotide, and putting it on people's skin. Now, this has started primarily in foreign countries, Brazil, Italy, where a lot of mesotherapy type of procedures are done to improve skin quality. And there is some anecdotal evidence to support it.
And they're doing it, injecting it, right?
They're injecting it, yes.
Yeah.
So these polynucleotides, what it's thought to do is activate and work along the fibroblastic pathway. So we know increased fibroblastic synthesis is going to help neocollagenesis as well as elastinogenesis in the skin and improve overall skin quality.
Right.
Now, these products are not going to work if you don't activate that wound healing cascade. So there has to be some sort of damage that happens, whether you're injecting it or microneedling it or using it post-laser, etc. Now, I have a couple in our office that I've been playing with. One is from Tuscany, one is from Poma Italia, so Brazilian and Italian companies that we're working with to potentially see if we can add some real science, some credible data to their repertoire. They have some Italian and Brazilian publications that do support it, but currently in the United States, these are only approved for topical use.
Right.
And now I do like these companies, but there are a lot of companies that have these products, and because they're not FDA approved for injections, there's no rules or regulations in the manufacturing process to instill and make sure that they are what they say they are, first of all, and that they're sterile and safe for human use.
Oof.
So the salmon sperm, or the polynucleotide itself, marine biology and marine life has a very similar DNA type as the human species. So these are thought to be the most biocompatible with the human body, with the lowest risk of having an immune response. Okay, that doesn't
applied topically,
post microneedling, or even injecting it.
So what has been your experience?
But that's not no risk. So that's what I would warn people out there. Now, my experience so far with light eyes, I've tried it on a couple patients with puffiness, dark circles. I have seen improvement as far as increased skin quality, decrease in hyperpigmentation, increase in skin turgor, so I do think it's working. I've been microneedling it in. I have off-label on a friend or two injected it with them knowing that this is 100% not something that we should be doing legally in the United States. But that's something that I feel comfortable doing on my friends and family members. Now, that is not something I'm going to be doing on my paying client.
On your patient.
On my patient.
So it's okay to do topically.
It's okay to do topically. It's okay to microneedle it so far. However, the FDA has been sending out a few warning letters to practitioners across the country
who are marketing
it or applying it topically on injured skin, because now we're in a gray area.
Right.
If there is injury to the skin and you're applying it topically through the dermis, well, now even though you're putting it on topically, you're theoretically getting past the dermis, so now it's an injectable.
Or even applied topically on OPM.
So if you're putting it on compromised skin and you have a reaction,
the problem.
It could be a big problem. So you just have to make sure you have an ironclad consent there. Now, there's a big difference between off-label and illegal. Okay, so there are a lot of things that I do in my office that are off-label.
Yes.
Okay? Because there's a lot of things in aesthetics that are approved in other parts of medicine. Especially with fillers and neurotoxins, using them in different areas that aren't FDA approved. But that's off-label, and that's not going to get you in trouble.
Don't do illegal.
Illegal, it would be injecting these products, because there is no FDA approved method or product currently in the United States approved as an injectable. So my advice to the practitioner out there is, if you're wanting to play with polynucleotides and you want to protect your license, I would probably not put it in a syringe with a needle on it.
Good.
Okay. Now, what you do behind closed doors, what you put on Instagram could be two different things if you want to play with some friends and family members and see. But just know, if you have a reaction, there's nothing there to protect your license. There's nothing there to protect your license.
So for the viewer, David, it's new, and I know, Kim Kardashian. So what was the common sense safe thing to say and to do, and how do you get it? The safe thing.
Yeah,
safe.
I like these two companies, Toscani and Promotalia.
Yeah, they're topical.
I vetted them out. They're topical. In other parts of the world, they're injecting it.
Right.
But in the United States right now, until we have better science that can without a doubt say it is safe to inject it, I think the best thing to do right now is just use it topically.
And for what use?
So for like fine lines, wrinkles, pigment, dyschromia, and overall improvement in skin. And I would probably pair it with like ablative lasers or microneedling.
Really?
Those would be the two my two sources of injury that I think would give the most bang for your buck, especially if you're not wanting to go down like the PRP or PRF or PDGF bandwagon or something like that.
And these are cost effective?
Oh, they're very, very, very cost effective.
Yeah, that's good. So, an update on Salmon Sperm. There may be some light at the end of that tunnel, as long as we get some science. It's good. David, great advice, great common sense. Yeah, be safe, be educated, know before you go. Till next time, stay educated before you use Salmon Sperm.